Hello, my name is Mayur. I'm a master's student in the School of Computing Science here at the Simon Fraser University. And today I'll be presenting to you a summary of my thesis, Multimodal Guidance for Medical Image Classification. Multimodal machine learning aims at analyzing the heterogeneous data in the same way an animal would perceive the world, which is by a holistic understanding of the information gathered from all the sensory signals. This multi-input data enables the animal to better navigate the surrounding than, say, a single input signal. Similarly, in a clinical setting, a comprehensive assessment of the patient's health would involve the acquisition of biomedical data from multiple different modalities. This is a common clinical practice. For example, the cancer diagnosis and prognosis decisions in the modern clinical setting are increasingly a result of a thorough examination of both the genotypic and the phenotypic modalities. However, although the complementary use of the multiple modalities has shown to improve the clinical diagnosis, the acquisition of these modalities is not equally feasible. While some modalities are easy to acquire, other modalities may be expensive with respect to the equipment, or may include longer wait times, or may have a risk to patients' health, such as in case of biopsies, where a patient has a small risk of bleeding and infections. Unfortunately, it turns out that in most cases, the more informative modality is the one that is harder to acquire. We call this the superior modality, as shown in the figure. Whereas the ones that are easy to acquire and provide somewhat less critical information about the disease are the inferior modality, and they are mainly used for the clinical preliminary diagnosis of the disease. A majority of works on multimodal disease classification rely on the presence of both the superior and the inferior modality during the inference time. However, in our work, we leverage the existing multimodal dataset during the training phase in order to enhance the performance achievable by the inferior modality during the testing phase or the inference phase. Our experiments on two datasets, a brain tumor and a skin lesion dataset, signify an improvement in the performance achievable by the inferior modality, while also alleviating the need for an expensive acquisition using the superior modality. Thank you.